Hello everybody, welcome to DocMed. My name is Uyi. Today we're talking about diabetes mellitus. Diabetes mellitus, or commonly known as just diabetes, is a disease that causes high blood sugar. So basically, there's an organ in our body called the pancreas. One of the jobs of the pancreas is to produce a hormone called insulin. The job of insulin is to take sugar out of our blood and put it back into our cells for storage or for energy. But when a person has diabetes, it's either because the pancreas is not making enough of this hormone, insulin, or the insulin being made is being rejected by the body. That's called insulin resistance. The problem when high blood sugar is not treated is it can lead to damage of the nerves, the eyes, the kidney, other organs. There are different types of diabetes mellitus. The one we'll be talking about today is diabetes mellitus type 2. And this is when your body is resistant to insulin. So basically, the pancreas is making the insulin, but the body is rejecting it. This type of diabetes is common amongst middle-aged people or older people. But now, we see it in children and teenagers due to childhood obesity. Now you'll be wondering, why should I care? Well, I'll give you some statistics. In 2016, the World Health Organization estimated that diabetes was the 7th leading cause of death globally. In 2019, 1 in 5 people over the age of 65 was diagnosed with diabetes, and approximately 463 million people between the ages of 20 and 79 have been diagnosed with diabetes. And this number is projected to go up by 25% in 2030 and by 51% in 2045, meaning in 2045 there'll be 700 million people approximately living with diabetes. And currently, 374 million people have an increased risk of getting diabetes mellitus type 2. Type 2 diabetes is a disease that prevents your body from using insulin the way it's supposed to. There are several symptoms, but some of the common symptoms that a person will experience are increased thirst, increased hunger, peeing frequently, weight loss without trying, getting infections, wounds that won't heal, tingling or numbness in your feet or your hands, excessive tiredness, or just feeling worn out. In addition to those symptoms that I mentioned, men can also experience low sex drive, erectile dysfunction, and poor muscle strength, whereas women can also experience increased urinary tract infections, increased yeast infections, or dry and itchy skin. There's also a rash, a dark rash that forms around the neck and the armpit when a person is resistant to insulin or has type 2 diabetes, and it's called acanthosis nigricans. So when you experience any of those symptoms, please see your doctor. Some things that can increase your chances of having type 2 diabetes are being over the age of 45, having a parent or a sibling with diabetes, being of African or American descent or Native American descent, having heart disease or blood vessel disease, having high cholesterol, being overweight, having polycystic ovarian syndrome known as PCOS, getting little or no exercise, excessive alcohol intake, smoking, stress, sleeping too little or too much. Now, how can you prevent it? Well, you just do the opposite of the things that put you at high risk in the first place that you can control. Like exercise 30 to 60 minutes a day. Have a healthy weight. So speak to your doctor about what a healthy weight is for you. Studies have shown that people who are overweight, who dropped 7 to 10% of their weight, decrease their chances of having type 2 diabetes by half. And there's also a link between tummy fat, the abdominal tummy fat, and insulin resistance, which can lead to diabetes type 2. Another thing you can do is increase your vegetables, fruits, and fiber intake, reduce your processed carbs, sugary drinks, red and processed meats, quit smoking, reduce your alcohol intake. And when you quit smoking, talk to your doctor about keeping that weight off. And if you're already pre-diabetic, start monitoring your blood sugar levels. For treatment of diabetes, the first step really is lifestyle changes. So all those things I mentioned about preventing it, try to do all of that. And when that doesn't work, your doctor will now talk to you about different medications that you can take to keep your blood sugar levels down. And for those of you who already have diabetes and you are taking metformin, please call your pharmacy. The FDA just made a recall on metformin ER because they found high levels of NDMA, which can cause cancer in some people. So call your pharmacy and find out if you should be returning your medication, and talk to your doctor if you should be switching your medication. Thank you. Please like, subscribe, share, follow me on all my social media platforms. That's Instagram, Facebook, Twitter. Thank you.